Yes, our people will talk say anybody wey get health, they say everything na him get. Ẹni bá lálàáfíà, ohun gbogbo ló ní. So health e dey very important. Health matter. In fact, that's why we call the program Health Matter. And you're welcome to another wonderful episode of Health Matter. As we dey take do am every Saturday, Shifolododo along Slimity and our doctor in the house, we go dey go through some things wey be say e get to do with health matter and solutions wey person fit prefer. Doctor.
Yeah, good
Good
morning.
morning, sir.
Yeah, good morning, sir.
How you dey, sir?
Slimity,
Doctor.
good morning.
Good morning, sir.
Yeah, you're looking a bit dull today. I hope you're okay.
Yeah, treating what is wrong with me.
You can say that again. Chief.
Good morning, sir.
Yeah, I'm happy to
How
be
the
back.
patient?
Yeah, we thank God. Good morning, viewers at home and around the world. My name is Dr. Bartholomew Tochukwu Febunam. I'm the Medical Director of Grace Valley Medical Center. Today, we are looking at malaria. 25th of April every year, the world commemorates, that was some 2 days ago, World Malaria Day. This year's event held in France, in Paris to be precise. It is a time that the world take a holistic look at where we started, where we are, and where we want to be concerning this disease that affects humanity. What is malaria? Malaria is something we all know in this part of the world because unfortunately for us, we are in an endemic malaria region. Okay? Malaria is a life-threatening parasitic infection that affects human as well as other animals, usually caused by parasites, Plasmodium species. There are several species of Plasmodium, but only 5 cause significant disease in humans. And they are, number 1, Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae. Okay? And the lesser known one, the 5th one is lesser known. That is a form of zoonotic infection. Okay? Now, how do we get malaria? Malaria is transmitted through bites from infected female Anopheles mosquitoes. There are over 400 species of female Anopheles mosquitoes scattered all over the world, but only about 30 of the species are of clinical significance. They are the ones that are capable of causing disease in man, talking about malaria. Malaria can be transmitted not just by mosquito bites alone. It can equally be transmitted through blood transfusion, organ transplantation, as well as from mother to a child. Those are some other possible ways of transmitting malaria, but they are not as significant as the ones that we get through mosquitoes. What are the symptoms of malaria? We all know the symptoms, or at least we have an idea of the type of symptoms that we usually see in malaria in this environment, but it's usually difficult to actually say these symptoms are precisely that of malaria. That is why the current teaching or recommendation from WHO at the moment is that before anybody initiates any form of treatment, because most of the time what we have in this part of the world, the narrative is that we usually do self-prescription. We go to pharmacy, to chemist nearby and purchase whatever we want to purchase and start taking, even without the benefit, availing ourselves with the benefit of having a test for malaria conducted. Okay? So it's advised that before you initiate any form of treatment for malaria whatsoever, you must at least have a test done. And that can always be done in a hospital setup. Okay. In places where, in case you choose to do it by yourself, you can go to a good diagnosis center or a good lab and request for the test. Okay?
But doctor, sorry sir, which one is more accurate, the urine test or blood test for malaria?
And the wider way,
or the wider test,
wider.
In terms of, thank you for the question. In terms of accuracy, the blood-based tests are usually preferred. Okay. Okay. The wider is a different ballgame entirely. Of course, it tests for a disease, a different disease entity, talking about enteric fever or typhoid fever, if you like. Okay. Now, I also want to give some WHO fact sheets on malaria. Okay. Number one is that every 2 minutes, a child dies of malaria. Yes.
Every 2 minutes.
Every 2 minutes, a child loses his or her life to malaria. And it is more in our African sub-region. Okay? Now, in 2007, for instance, over about 219 million people were said to have been affected in 87 different countries of the world. Okay? And out of this figure, almost half of them were from 5 countries alone. Talking about malaria endemic countries. And of course, Nigeria was topmost on the list with about 22%, followed by Mozambique with 11%. And then you have Nigeria, Mozambique, you have India, as well as Uganda. Okay? Now, these are countries where malaria is endemic. And when we talk about endemicity of malaria, we pay more attention to Plasmodium falciparum, which is actually the one that is responsible for causing 99.7% of all malaria that we have in WHO African sub-region. 99.7% of all malarias we have in this environment are caused by Plasmodium falciparum. Okay, so that is the one that we should pay more attention to. Also, in other WHO sub-regions, Southeast Asian sub-region, Eastern Mediterranean, as well as Western Pacific, Plasmodium falciparum equally predominate. But in some places, you have Plasmodium vivax also coming second in some of these places. Okay, now, who is at risk of having malaria in this? Who is at risk of having malaria? Now, everybody that lives in this part of the world that we mentioned a while ago are equally at risk. Okay, but the risk is more in some certain groups of people. Okay, talk about the risk is higher in children that are under 5 years of age.
Okay.
The risk is higher in pregnant women. The risk is higher in people who are living with HIV/AIDS. Okay, they're much more prone to having malaria. Beyond that, malaria is usually much more. The effects of malaria in this group of people are usually more devastating than all other people.
Okay.
Now, why is this so? Okay, now, to guide against that, we usually, what WHO advises that this group of people should have chemoprophylaxis for malaria. What that means is preventive treatment for malaria.
Which is mosquito net or what?
No.
That's
a set of.
Does it have to do with chemotherapy or something? Because the word chemo.
Yeah. No. Forget about chemo. Prophylaxis. Prophylaxis is actually giving medication in a bid to prevent someone from having a disease ahead of time. Okay. For instance, some migrants that want to travel or that are coming into Nigeria, they usually start themselves on some form of anti-malaria drugs 2 weeks before coming to a place like, or not just Nigeria, to other malaria endemic regions of the world. Okay, so that's a form of prophylactic treatment. In our environment too, we do that for pregnant women, in which case we'll give them what we refer to as intermittent preventive treatment or intermittent preventive therapy, if you like. Okay, usually it's advised for pregnant women. WHO advice that they should be given that after first trimester of pregnancy, after the first 13 weeks of pregnancy, they should be given that several courses before the completion of pregnancy. Ditto for children who are under 5.
Thank you.
Ditto for children who are under 5 years of age as well as people with sickle cell disease, anemia. These people ideally should be on prophylaxis for the rest of
But
their
doctor, why
lives.
do I feel those people with sickle cell don't really suffer malaria as much as people with AA? Because I think that's like the
comparison, thank you very much for the question. The comparison is actually between people with genotype AA and AS. Okay, not with
SS.
yes, not with SS. Now, people who have SS have what we call autosomal recessive gene. They have homozygous 2 copies of the same trait, SS. Okay. Unlike people who carry the trait, people with genotype AS, we call them heterozygous group of people, in the sense that they have one normal gene and another abnormal one. So they have AS. So they carry the sickle cell disease trait. The same reason they advise not to marry people with similar genotype, okay, so that they don't end up giving birth to sicklers. Now, the comparison is actually between AA and AS, people who carry the trait. Now, I also want to point out that it is still a lot of gray areas. It's still a study in progress. Okay, but what we know at the moment is that part of the reason why it is so, number one, is that it is true that people who have genotype, especially in children, AA, are much more prone to having malaria than.
And why is it like that?
Than AS. And the reason why it is like that is because the protein that is contained in the red blood cells, we call that hemoglobin. Okay. The protein that is contained in the red blood cells that we all have in our body is actually the component in the red blood cell that carries oxygen. And if you remember what we talked about last week about the life cycle of malaria parasite, we said that there are 2 phases of life cycle of malaria parasite: the one within the gut, the intestine of the mosquitoes, and the one within humans. And in the humans, we have 2 as well. The one within the liver, the replication that happens in the liver, and the one that happens in the blood. Okay? Now, in the one that happens in the blood, what happens is that the red blood cells. Okay, let me start so that we can all understand fully what I'm going to explain. In the life cycle of mosquito, when a female Anopheles mosquito bites, an infected one though, bites a human being, it releases sporozoites into the blood. Now, these sporozoites will travel down to the liver in the human body. And, of course, they will start replication as merozoites. They grow by way of replication within the liver cells that are called hepatocytes. And after a while, they burst the cells and they are released into the bloodstream. Now, when they get to the bloodstream, they enter into the red blood cells, and the same process of asexual replication will continue until the blood cells becomes big and then burst, releasing more malaria parasites into the blood. That's actually the infective stage. Now, for people who have the sickle cell trait, because of the fact that the oxygen carrying capacity of the blood is reduced in people who have AS, okay, and these parasites, we were told, feed on hemoglobin as well as oxygen. So any blood that cannot carry good amount of oxygen will deprive them of their activities, and of course we limit their the processes that brings about infection. So that is what happens in that scenario.
Okay, let me pause you a bit, doctor, so that we can open the phone lines. Viewers at home, make una feel free, make una ask us anything where they do your mind yaga yaga as far as malaria is concerned. Maybe you dey treat malaria from time to time, no go ni. Abi maybe you get 1 or 2 symptoms where you even feel say, this thing abi na malaria, abi no be malaria. Dr. Bazi dey in the building to answer any question as far as malaria is concerned. Feel free call us. Turn down volume on your TV set so that we go enjoy the communication.
Yeah, thank you very much. Now, still talking about the disease burden of malaria in this our environment. Okay, I also want to point out that over the years, from the year 2000, a lot of significant advances and gains have actually been made in trying to curtail malaria in our environment vis-a-vis the whole world. Okay, but in the last couple of years, in the last few years, all of those progress have stalled.
Why?
Okay. Now, it could be as a result of many reasons. Number one, the policymakers appears to be losing steam in terms of bringing out. I think we have Leko from Niger State.
Leko, good morning, sir.
Yeah, good morning, sir. Doctor.
Yeah, good morning, Mr. Leko. How are you today?
Good morning, sir. Fine, sir.
Yeah, thank you.
Please go on with your question.
Yeah, I want to ask you something. Sometimes I do wake up with headache.
Okay.
Yeah, I don't know what causes it.
Sometimes he wakes up
Okay.
with
How old are you, Mr. Leko?
Hello?
How old are you, sir?
Yeah, I'm 29.
Okay,
29.
Okay. Now, I asked about your age because that will enable me to actually give you a number of differentials that could be responsible for the headache that you mentioned. Number one is that the headache can come from the commonest of them all.
Stress.
That we treated last week.
Stress.
Eh?
You said?
The headache could be as a result of stress.
Stress.
A day before.
Stress,
Yes,
yeah.
stress. It could be as a result of stress. Common things occur commonly. Okay. Now, but
Inadequate
if the
sleep.
headache persists, okay, you may need to look beyond stress.
Yeah.
In the sense that it could be as a result of the malaria that we are talking about. It's not everybody that ends up picking malaria that actually comes down with the disease. Okay. In some people, it's asymptomatic even when they're infected. Okay. Now, other causes of headache may be hypertension. Okay, but that may not be in your age group. Also, in this environment, typhoid too can cause headache. Okay, so these are some of the causes that can lead to someone having headache. So if you persist, I will advise that you need to get yourself checked. You need to go to your doctor for further evaluation. Okay.
Okay.
Yeah. So let's go back to your question.
Okay.
Your last question.
Yeah, no, I said, I asked about, I think, no, you've actually explained. That was the AA. and
Okay,
SS.
okay, so
And then I think I would have loved to ask, is it proper for you to treat malaria 4 to 5 times in a year? No, seriously, because no, doctor, the only sickness why they get na malaria. And when I want to treat, I give it adequate treatment. But then at the end of the day, maybe go just give me a break of 1 month or almost 2 months, and then thing comes back again.
Okay,
so you'll be wondering, like, what is the reason? What is the cause? That's what I'm asking, like, is it okay for you to?
Let me take from thank you for the question, but let me take you from where you started. Is it possible for one to treat malaria for as much as 5 times a year? You can actually treat for much more than that. Okay, but now I still want to come to you. You said adequate treatment. I want to probe for the adequacy of your treatment.
Injection. I don't like injection, but most times I have to
in all these occasions that you've been treating that you've received treatment. Let me not assume anything here. Did you try to do tests prior to commencing the treatment?
I think I did.
In all the occasions.
I did once.
Okay. Another thing I would
Okay,
like
so somebody is debatable that in all those occasions that you probably felt you had malaria, that it possible could have been some other bystander that you never thought about. Okay, so that's what we are talking about.
Okay. Can I quickly ask this?
Yes, you can, sir.
If we want to do malaria test, if person get malaria, they will do test. They go know, say, okay, now waiting they do on malaria, they commence treatment. But after the treatment, I've come to realize that nobody, they always talk, say, let's check
If
the amount of malaria either left in the system or there's none at all. Why? And even I feel I know, well, don't let me assume, but I feel most people, once doctors don't complete our dosage and injection, we go home. We know they go back to say, okay, take some sample of this person's blood and check if malaria remains. And I feel doctors are guilty too.
Because you guys don't tell us to come back.
Yes.
Well, I'm a doctor. I may not want to put up a defense along that line.
But you know, say they happen.
Yes. In as much as I want to agree with you that you have a point in that, I also want to say that oftentimes, because of paucity of funds, because of financial constraints, okay, we seldom asking people to come back for not for checkup. People should ideally come back. We ask people to come back from checkup from time to time.
For taking of blood for
a repeat test.
Okay.
Okay. For instance, if you were put on treatment for malaria, usually when you get well, oftentimes what we say is that once the person begins to get well, the person may not even finish the dosage of the drug, of the prescription that must have been given in the hospital. That's one way. Two, there could be treatment failure. But in situation where the person got better and got well afterwards, the person usually doesn't go back to the hospital.
Because people don't ask us to come.
We do, but like I said at the beginning, I don't want to put up a defense along that line, but it is not always that we ask people to come back. And I've just explained to you that one of the reasons can be due to financial constraints. Because sometimes when people come and we offer to do the test for them, they will say, Doctor, I already know. I have Christy from Calabar. Christy, good morning.
Christy, good morning.
Good morning.
How are you doing?
I'm fine.
Doc is here.
Dr. Bat.
Go ahead
Please
with your
go
question.
on now. I said Dr. Christy.
Hello, I want to speak with Dr. Bad.
He's ready
go
to
ahead.
talk to you. Go on.
Okay. I want to ask why those with sickle cell anemia don't suffer malaria.
Those with sickle cell anemia
They don't suffer malaria.
don't suffer malaria. Okay, thank you very much. You sound like a medical person. Are you a doctor?
I think he's gone.
Okay, I think she's gone. Those with sickle cell anemia don't suffer malaria. Now, if I got her right, I want to make a distinction here. Number one, we talk about people with sickle cell trait. That is people who have genotype AS. Different from people who have sickle cell disease or sickle cell anemia. That is people who have genotype SS. Okay? Now, the people we are saying that they have some degree of protection against malaria is people with the sickle cell trait, AS, not the people who have sickle cell anemia, SS. They are disadvantaged on a number of reasons. So they actually have malaria. The malaria in them is worse off than the other groups under consideration. Okay, it's worse off with the other group under consideration. But sometimes we mix up the terms. Okay, now it is so because the heme, which is the protein that is the protein that is contained in hemoglobin. Okay, now the red blood cells is deformed. We have David from Edo. David, good morning. We'll come back to the question.
Hello, good morning, doctor.
Yeah, good morning, sir. How are you today?
Well done, sir. Very fine, sir. Your program has been very lovely on WAP TV, sir.
Thank you very much, sir. We appreciate
Yes, sir.
you.
Yes, sir. Please, sir, I have a question. Somebody beside me here is after having a complaint. I don't know if it's going to be related to malaria anyway.
Okay.
He's saying that he's not be able to cough. I think he has cough within his chest and throat area, but he's not able to cough. So when we saw the opportunity, I said, okay, let me call our doctor on WAP TV to see if he can help us out to tell us any advice.
Okay, hang on. Don't go, sir. Hang on.
All right.
Now, when he
All right,
coughs, does he cough out anything like sputum?
No, he does not cough out anything. But he just know that there's cough within his throat area.
Okay. Thank you very much. Now, there could be a number of other causes of a cough could be a symptom of a number of other diseases. For instance, somebody who has upper respiratory tract infection may have cough. Okay. Somebody who have malaria too, it can actually present with cough. That's one of the symptoms. Okay, flu-like symptoms, cough, catarrh, headache, fever, chills and rigor, abdominal symptoms, nausea, vomiting, generalized body pains, and what have you. Okay, so, but the periodicity of the cough, how long it has lasted, is equally as important. If it has been on for a longer period of time, there will be need for evaluation. Okay, sometimes if it just one-off, comes and goes, okay?
Yes.
When we expose ourselves to cold, that can happen, especially when we sleep under a conditioned environment without covering ourselves properly before morning. At the middle of the night, you discover that you can just wake up and start coughing, and you were not coughing prior to going to bed. Okay, so that can happen, but usually that wears off after a while. But the cough that will persist beyond 2 weeks is likely to be pathological. It's likely to be associated with a problem. That is the type of cough that one may have in tuberculosis. So if the cough is getting prolonged, there is need for evaluation. Thank you very much for that question.
Quick one, sir. I noticed, whenever my picking, we have a caller. Hey, Pere from Bayelsa.
Bayelsa.
Sir.
How you doing?
Fine, sir.
Well done. The doctor is here.
How is Bayelsa today, sir?
Sir is okay.
Yeah, thank you very much. Welcome to the program, sir.
So no way to come out. We are just in the house.
Okay.
Okay, yeah. To your question, please.
My question is, always, early in the morning, I'm feeling hungry by 6:30, 6 o'clock. I don't know.
You feel hungry. It's a good
Eat
sign.
Why are you hungry?
Is it not?
No. Let's
it a
find out.
problem?
Let's find out.
Okay.
Are you on the fat side, sir? Are you big?
No.
Oh,
I'm not
okay.
big.
Okay, because I can't ask you to continue to eat because of course you'll become overweight over
Okay.
time. But eating, yes,
Not early.
yes. I think it may have to do with you as a person.
I want to ask that whether eating early is not good or not. I want to know.
No, eating is good.
Early, he says now.
It can be at
can
any
eat
time.
any-
No, he
Anytime.
said he wants to know if eating early.
Early.
Early is good. No, anytime you feel hungry, you want to eat, please go ahead and eat.
Even
Okay,
if
but
it's in the middle
do
of the night.
yeah, do that with moderation. Yes, some people wake up at the middle of the night to
Tí wọ́n sì
eat.
tẹ
Well, we
ẹ̀bà.
feel-
Depending if the
That will
person
make real
if the
ẹ̀bà.
person may not have eaten during the day and all that.
But there are times
It's
that
just
we
a
feel,
response to your. It's just getting a feedback from your system. Okay, but that said, I also want to say that there are some eating habits that could pose a health
Threat.
risk.
Okay.
Okay. By the same token, there's some form of, I don't want to use the word starvation, but that's what will bring out what I mean. For females who want to look slimmer, like Slimity, okay, some of them will have compulsive obsession, to avoid
Some
food
certain, yeah.
as much as possible so that it will not affect their weight.
It's
Over
not that we try
time,
to avoid food, though. The doctor, it's just that we have some particular food. Like, okay, I was almost asking. I wanted to ask something related to what you just said.
Okay.
Like, there are some particular foods I don't eat once it gets to a particular time. Like, for me, once it's 8, I don't like to take anything again. If I would take anything at all, it would be fruit. Okay, so, and once it's evening, 7, 8, I don't do anything solid, because I feel it will not digest beef, all of those things I don't do. So anything that does not make me eat solid in the afternoon. So really, does it really matter? Because we've had cases that I will tell you, if you eat solid in the night, it will not digest, it will worry your stomach. And we don't want to have big stomach. I mean, doctor, I don't want to have. We are trying to keep this figure of ours. So we are trying to restrict ourselves from.
yeah. So long as you don't take it to a problematic zone, in the sense that when people who have those problems, we'll call them anorexia nervosa. People who have those problems, it may start losing body mass that could pose some health challenges. By the same token, excessive compulsive eating too can actually lead to obesity. So you just have to be in between. Whatever you have to do, please do it with moderation. Okay, so very quickly, I want us to take a break so that we can quickly see what the Director General of WHO has to tell us about this year's World Malaria Day.
Okay.
The technical department will help us. We'll come back.
All right, guys.
Thank you.
The world has made incredible progress against malaria, but we are still too far from our goal, a world free of malaria. Malaria strikes more than 200 million people every year, and every 2 minutes a child dies from this preventable and treatable disease. The damage inflicted extends far beyond loss of life. Malaria takes a heavy toll on health systems, sapping productivity and eroding economic growth. Last year, WHO and the RBM Partnership to End Malaria launched the High Burden, High Impact Initiative to accelerate progress against malaria. For World Malaria Day, we're joining countries and partners with a clear message. Zero malaria starts with me. We're calling on political leaders, the private sector, and affected communities to take action to improve prevention, diagnosis, and treatment of malaria. We all have a role to play. Ultimately, investing in universal health coverage is the best way to ensure that all communities have access to the services they need to beat malaria and every other disease. This World Malaria Day, join us in declaring zero malaria starts with me.
So welcome back once again. Thank you so much, Director General, WHO, Dr. Tedros Adhanom Ghebreyesus, for that wonderful piece. Zero malaria starts with me. Zero malaria starts with you.
Zero malaria starts with me.
Yes. Now, what that means is, I want to quickly mention something here. Total funding, or READ, total funding for malaria control and elimination reached an estimated 3.1 billion in 2017. Contributions from governments of endemic countries amounted to $900 million, representing 28% of total funding. I want to say that the endemic governments of endemic countries, not just government of endemic countries, we need to do more. If our own contribution is just 28%, it's not good enough. Okay. And we also want to appeal to individuals, private sector, non-governmental organization. We should not leave the work for the government alone. We have someone from Anambra State.
Blessing, good
Blessing,
morning.
good morning.
Oh,
Oops.
he's gone. Well, he's gone. She's gone. All right. Hello, Blessing. Okay, please call us back. All right,
okay, so we need to do more. We need to take hold of the initiative. We need to take ownership of the initiative, okay, to stop or limit the damage that malaria is causing our environment. It's not just the health challenges alone. It depreciates and affects working hours. It affects the economy of a nation, because instead of using our scarce resources to fix in some other place where they are most needed, we have to be channeling it towards challenges that come from health. Okay, so everybody, all hands must be on desk. With that, I want us to move straight to transmission, and then we'll go over to prevention, because that is where we need to lay more emphasis on. Okay, transmission. I've said that malaria is transmitted when an infected female Anopheles mosquito bites in humans. Okay, there are other forms of transmission which we have also mentioned that are not as important as the spread through mosquito: blood transfusion, organ transplantation, as well as mother to child, to an unborn or to a newborn baby, okay, which we'll call vertical transmission. All of these are possible. Talking about prevention, what are the things we need to do? Okay, it could be on individual basis. It could also be at government or community levels. Okay, now essentially, the distribution of insecticides treated nets.
So we have Dominic.
From Kaduna. Dominic, good morning.
Good morning, Dominic.
Yes, good morning.
How are you there? You need to speak louder so that we go hear you well.
Okay, I should speak louder now.
Yes, better.
Yes, good morning, doctor.
Good morning, sir. Mr. Dominic.
I'm suffering from malaria, especially my test is always on typhoid and malaria.
Okay.
Sometimes they will say it's a parasite. I'm now even on drugs, and I'm over 70 years. What is the next treatment that will make me not even 3 to 4 months? I will fall on malaria day again.
Thank you very much. Thank you very much, sir. Thank you very much, sir.
Papa.
Yes.
Yes, so
That's
yes.
because that is my
That is my own of sickness, malaria.
Do you have an idea of your genotype, sir?
Yes, genotype is A positive.
AA or AS?
A positive.
Okay, I think you should be talking about blood group. But thank you very much. We got your question. So just listen. I'm going to tell you some of the things you need to do.
A positive blood.
Okay. Thank you very
Papa,
much.
don't worry.
There are actually four major genotypes, but health professionals will tell you that there are more than 4. Okay, you have AA, you have AS, you have SS, and you have AC.
AC.
Okay. Okay. So, but there are actually more than that. Okay. But whatever, let's answer his question. So, what you need to do, sir, is prevention. Okay. You may need to get an insecticide-treated net, mosquito bed net. That's one of the ways through which we can actually prevent it. In communities where insecticide-treated nets are widely used, it has actually helped to lower the degree of infection or the intensity of the infection of malaria in such environment, because the insecticide-treated net will prevent you from having malaria in 2 ways. Number one, it serves as a barrier that can physically prevent the mosquito from getting across to you or from coming in to bite you. Number 2 is that it is treated with an insecticide, pyrethroid. Pyrethroid is the name of the one of the components that usually is treated with. Okay, so this has the capacity to kill mosquitoes on its own. Okay. So any mosquito that perches around, it prevents the mosquito from getting to you, and of course it has the capacity to also kill the mosquito. Okay. Now another thing that we can use is indoor spraying with residual insecticide. We call that indoor spraying with residual insecticide. We call that ISR. Okay, now what that means is not the usual or the common fleet that we usually use in our homes. You need to do this like once or twice in a year. You see people who carry some spraying equipment. They usually come into our compounds, into our houses. Yes, just something like fumigation. Okay, so something like fumigation is usually done once or twice a year.
We call it umpa.
Yeah,
now
but
you understand.
Thank you very much. Thank you very much.
They carry something for back like school bag.
Yes. So they will spread your houses, every nook and crannies. It helps to cut down on mosquitoes. Another thing that you could do on your own that the government does not need to come around you to do is to make sure that you don't have collection of stagnant waters in and around your homes.
Now they need to sanitize those.
That you don't have bushes around your home. We do know that in this environment that sometimes the intensity of the infection could go up usually during the rainy season. Usually about the time we have.
Calling back.
From again. Good morning once again, Pere. Pere. Pere.
Hello?
Hello, where are we to, sir?
Back.
I'm calling back because sometimes my body feels weak.
Okay.
It's the same person that said he eats in the morning.
Oh,
Well, please call us back.
Sorry for...
Call us back, please.
We lost that, please.
At least, yeah. Okay, doctor.
Okay, so these are major ways through which we can use to help ourselves. Okay? Making sure that we don't have stagnant waters, making sure that our doors and windows are screened because we have mosquitoes in and around us. Okay? And then, in some occasions, you could also use the regular insecticide that we use in our homes. But these days, what we are saying is that these so-called insecticides, a number of countries, about 64 countries, have reported that the mosquitoes in their environment are beginning to develop resistance to this, to one among the 6 classes of agents that are used for insecticide. About 57 countries too have said that they have also reported that they have seen resistance, they've experienced resistance in 2 out of about 6 classes of this insecticide that are generally used. So there is a deviation from the pyrethroid insecticides to some other much more expensive alternatives that are usually not easy to come by.
I just think, doctor, I think one just needs to be very careful, because why I talk so be say these days now, in the wanting to kill mosquito, I don't want to mention any brand name.
Yeah.
There are some
They
very
get
strong
Yeah.
insecticide.
Overnight.
Maybe say if person is spraying hand like this, say understand. They come majorly in liquid forms anyway. If person use and finish, if you are not careful, it can spark this breath issue. Now, what is it called?
You're 100% correct.
What is this breath issue?
Asthma.
Asthma. It can spark asthma in person. I think you should just dwell on that.
Yes.
Because I think I have a victim.
Yes, it's important too that we talk about what he has just mentioned. Thank you very much for bringing that to focus. It's not just insecticides now that can actually give us such presentation. If you use some perfumes that have strong
fragrance.
Yes, that have very strong fragrance, that can actually happen. Okay, if you use it close to someone who has asthma, that can precipitate an attack. Okay, so it's advisable that if you have somebody who have upper responsive airway disease like asthma or that is allergic to some of these things in the house, as much as possible, you should avoid doing that at all. If you must do it, let it be done in the morning, so that if the person is coming back later in the evening from work, the whatever the odor of the smell would have been done away with. Okay, and it's also advisable after doing it, open up the windows, and you can only do that if your windows are screened and doors, so that you can have adequate ventilation. Otherwise, in trying to prevent one from getting mosquito, you can actually predispose yourself
to a serious disease.
To much more serious.
You need to be careful. I think everything should
So one needs to balance the equation in all of that. So very quickly, treatment. The mainstay of treatment of malaria these days is ACT, artemisinin combination therapy. Okay. It's on that note we want to end the presentation on malaria today in view of the World Malaria Day that just ended 2 days ago.
Are we continuing again
another new topic next week?
Yes, depending on the demands that we'll get. Okay. So from me is bye-bye. I'm from Slimmy T.
I'll see you guys.
Okay.
I'm from our chief in the house.
Thank you very much. They always stay tuned. Bye-bye. Take care of yourself. Be good. Slimmy is still going to be around.
Yeah,
1
see
to
you guys
2.
1 to 2.
Don't miss it.
Thank you very much.
Bye-bye.
Bye-bye.